Hey friends, it's Pastor Tom Arthur, and I'm here with Bob Trout, who is a partner at Sycamore Creek. Like you were one of the founding
Yeah,
group,
remember
right? Yeah, you've
one of the 30. Yeah,
been been with us for a long time.
long time.
Yeah,
Yeah.
and we're sitting here in his house at his kitchen table, and actually with the the
Last Supper, right
Last
here.
Supper
Yeah,
right over. So we know you're a real Christian. 'Cause you
very
have
much
that
so.
hanging in your
Yes,
kitchen.
it proves it.
But pertinent to today, well, actually, you oversee the communion elements at our church.
Yeah, I do.
Yeah.
Help out with it.
Yeah. So, but you've got your official tag on
Oh
here.
yes, I'm official.
You're
Sparrow.
one of the infection preventionists at
Yes.
Sparrow Hospital.
Right.
What does that mean?
Oh, essentially means we try to do all the things to help prevent infections that may occur in the hospital that occur with either mostly patients, but also with visitors and other staff that may interact with the patients.
Mm-hmm. And I know you've participated in our medical missions trips to
Sure.
Nicaragua, and you've done community health.
Right.
And is that something you officially do as well, community health, or is that something you're just doing
No,
on the mission field with us?
with the mission field, but one of my jobs at Sparrow is to I'm one of the liaisons for education for infection prevention at the hospital. So I'll do that. Create education programs to help with all these things we try to teach people to do
Yeah.
better.
So you've been busy lately.
Oh yes, very busy. Lots of opportunities.
Yeah. It's you're a really jovial character, so we're talking about a heavy topic, but you and I joke a lot. Like this
Right.
is your demeanor is often one of smiling and laughing with me and
It's
making
true.
jokes and so on. But there's a lot of people who are really nervous about
I know.
coronavirus.
Yes.
And I want to get just a little bit about what are the key things people need to know, and then talk with you a bit about how that affects our church. But I think that probably I coach a lot of pastors, and so they may be using this as a resource in their own
Sure.
reflections on their own church experiences. And
Mm-hmm.
there's not a lot of people who have the specialty that you have who are talking specifically to churches.
Mm-hmm.
So give us the lowdown on what we need to know, kind of in brief. I mean, there's so much out
Yes,
there,
yes.
so we don't need to go in deep into this. But what are the essentials that people need to know?
Well, the first thing about coronavirus is it is a flu. It's a flu much like the other flus that are out there, the seasonal flu, and it can hit people hard. You get body aches, you get cough, you get sneezy, you get headaches, you feel terrible. A lot of people that get seasonal flu get it so bad they wish they were dead, and then they wake up and they're not. So, but most people with this coronavirus, about 80% of them will survive just fine without any medical treatment.
Mm-hmm.
About another 15 to 18% of the patients that get this the people who get this will go in a hospital and need some intensive care, so or some very very strong care. But most people do survive and get over this. But it is a bad flu, and it is a little bit more transmissible to other people, and that's why we're taking all these precautions as far as limiting a lot of activities and such right now.
It seems to have to do with like lengthening out the spread of this so it doesn't hit the
Exactly.
healthcare system with one big spike.
Exactly, because right now at the end of the flu season, and also already having some limited services within the community, less physicians available, less outpatient visits available. If we had a huge spike, we really wouldn't be able to take care of everybody very well in a very timely manner, like we do now. But it'd be overwhelming to the system.
Mm-hmm.
So the goal is to minimize the initial exposure, so we have less people spread over a longer period of time.
What do people need to do to minimize
Okay.
exposure?
Essentially, the biggest thing, you've heard this before, is to go ahead and wash your hands frequently with soap and water or the alcohol gel. To not touch your face and nose or anything with your hands, because you'll pick up things in the environment, and if you are taking them up to your nose, you're contaminating yourself. The other thing is cough. If you have a cough or a sneeze into your elbow like this, it's kind of gross, but it also will help keep that stuff off your hands.
Mm-hmm. You just helped, actually, before this was even a thing, install new hand sanitizers throughout our building.
Well, it's nice. We had somebody who was able to donate those, and we got those available. So it is nice. It's good to wash your hands frequently.
Yeah, yeah.
One of the other things with the state of emergency we've got going on right now, that's not to be anxious about it, but it's also to help prevent that spread. So the big thing is to really, if you want to stay away from people a little bit more, not to shake hands, not to do big old hugs, and just to kind of do elbow bumps is
elbow
good.
Bumps.
Yes.
Yeah. Bows.
Bows like the Muslims do. It's really nice to say hello, nice to see you, nice respect. And that's a lot of what we need to do. Just kind of watch how we are amongst other people. I guess the other thing too is we do have a big issue right now as far as people hoarding things. Some of the less fortunate may go to the store and find the store shelves bare, and just because they're worried about toilet paper.
Yeah.
Well, you only need one extra can of Lysol, one extra jug of bleach. You don't really have to hoard things.
We're talking about gluttony this Sunday, and this is a kind of
that's handy.
Gluttony, like of hoarding, like of
Yes.
grab. I mean, I was in Kroger last night just to get some fruit and stuff, and
Right.
I happened to walk down the aisle of the toilet paper, not because I was looking for any, but it was just
You gotta
bare.
notice it's not there.
Yeah, I was like, oh my gosh, there's
Right.
all these. This is just a run on it.
Right.
So take what you need, but you don't need to take more than you need.
Right. One of the other things is with these, we'll have closures of different, like MSU is now closed, and that is to limit the spread of people coming in and interacting with other people as far as classes and moving around a lot. A lot of facilities you may see nursing homes limiting visitors. Sparrow just today decided to limit it to one visitor per person coming into the hospital. You'll see much, much more of that. Keep in mind that there's people out there that aren't going to get visitors anymore. So it's helpful to call your family member that may be elderly. Talk to people on the phone and make sure that they're included in your lifestyle.
Yeah.
Especially since you can't see them.
Yeah. There's some racism and bias coming up in the midst of all of this too that you were writing me about.
Oh yeah, I get questions about whether we can open the packages that we've got from China or pop the bubble wrap. All that stuff. The virus is fairly fragile, gets killed fairly easily with both disinfectants, but also if it's dry in a dry box or something, it's not going to last for more than a few days. So it's really okay to have packages. It's okay to go to Chinese restaurants to eat with chopsticks. But it's also okay to talk with folks because there's been a lot of bias against Asian folks and other folks, foreigners, that simply have no blame of it their own, but it originated in Asia and they're not to blame. It's just it just happened. So
yeah,
we need to be nice.
So let's talk about church. This Sunday, I texted you and said, do we need to think about canceling? And you emphatically said no.
Right.
Why should our church or churches like ours at this point decide not to cancel?
I think at this point, we have a great opportunity to show how we can be really good Christian people towards each other. And I mean that in a way that if we can really look at people as wanting to be do unto others as you do unto yourself. Old phrase. But pretty much, if we know that we've got a cold, or been around somebody that's been sick, or have a cough, we can stay away from church, or we can distance ourselves. But if we can keep a fairly, if we can make sure that everybody knows the ground rules as far as what we do in big gatherings like at church, and try to not give somebody else something, I think we can keep meeting together and be healthy. We wash our hands. We've got those hand stations. We can cough into our sleeve, what we said before. But if we can keep our bugs to ourselves in an intention of not giving it to somebody else, I think we can make this work.
Yeah. So we're also under that 100 limit that the governor was suggesting.
Right.
All of our gatherings tend to be under 100.
Right.
And so we're going to do. We actually had planned to do communion this Sunday,
Right.
and we were thinking a little bit about that.
Yeah, we have other options, like we said, about not passing the basket back and forth between people with the communion to the people that are providing it will be washing their hands maybe a little better, more frequently, just using the bread instead of maybe dipping it into the wine. Or
There's actually a long theological tradition of one element in communion being sufficient for the grace of communion. So we always have servers that rip the bread. There's just one person touching the bread who has sanitized their hands and gives it to each person. And if somebody doesn't want to put it in the cup, dip it in the juice, theologically that's fine. There's no problem with that. So
great idea. Yeah.
So we and you oversee communion, so we'll trust our.
We'll be careful. I guess.
We'll trust our infection preventionist to help us stay safe there.
Yeah.
Are there anything else you think that churches need to pay attention to, or that we at Sycamore Creek especially need to be thinking about?
Boy, I don't think so.
Yeah.
You got any ideas?
We were thinking about in the coffee cafe that we would have more of a barista feel. So you'd go up and you'd order your coffee, and one person would serve your coffee to you. So we don't have self-serve.
You know, that's a great idea, because at this point we don't have any cases in Ingham County of known coronavirus. But again, this goal is to cut the spread of potentially unknown cases. So if we can limit those points of contact with other people where they're touching a community touch to the coffee dispenser or to serving plates and stuff,
offering buckets,
all that stuff.
Yeah,
that's going to cut down any risk to everybody.
Yeah,
and help everybody out.
We'll have offering bucket stations instead of passing the buckets.
Super.
It also shows, at least, this is not really up your alley exactly, but when people give electronically, like, this is an opportunity for.
Oh, that's a great idea.
Too, right?
I hope everybody does that.
So, you didn't. That wasn't on your mind.
I know. It works.
Actually, this whole thing about thinking about closing doesn't freak me out. But a lot of churches, I think, would be freaked out because they don't have those kind of resources, or they haven't built that system, and so not receiving an offering for 1 or 2 or 3 weeks could be really damaging to their community. So, so we're not making decisions based on that, because 60 to 70% of our giving comes in electronically.
I think cleaning down the environment a little more frequently during right before church service, even right between services and stuff, to help just minimize the amount of bacteria or viruses that may get on the door handles and stuff and rails is going to be helpful too.
So we're going to take some time to interview you in worship again on Sunday.
Oh, great.
In both services. And then we're thinking about having you in the basement to do some Q&A with people that want to ask you about all their anxieties. And
there's a lot of questions we didn't cover today, but there's just and a lot of things are unfolding, and unfortunately there's a lot of stuff that's out there that isn't quite exactly right. So I'll try to do my best to help out, give some good answers.
Yeah. Thank you for taking the time
to
sit and chat with me about this, and we'll see you on Sunday.
See you in church.
All right.
Yeah. Okay.
Bye-bye.
Thanks.